Hey friends, welcome back to Aged and Confused, the place where we don't sugarcoat aging, we sweeten it with real talk and a touch of wit. Today, we're diving into why so much health advice for seniors just doesn't fit. Why is it that people over 60, 70, 80 get health recommendations that either scare the life out of them or make them roll their eyes? By the end of this video, you'll know what to question, what to trust, and how to advocate for your health. Let's get started. Let's be honest. The health world loves labels. Over 65 suddenly becomes a catch-all category, whether you're still hiking mountains or using a cane. That 2020 Lancet Healthy Longevity paper I mentioned, it found that biological age markers like inflammation levels, muscle mass, and balance tests tell us more about someone's health risk than their date of birth. Think of it this way. You wouldn't buy a one-size-fits-all pair of shoes. Why do we do it with health? Guidelines often say older adults should aim for 150 minutes of moderate aerobic activity per week. But moderate for whom? A fit 75-year-old's moderate might be jogging. For someone recovering from surgery, it might be slow walking. Dr. John Rowe from Columbia's Aging Center says this: chronological age is a poor guide for medical decisions. Functional measures are what matter. Let's bust this myth wide open. We've been sold the idea that aging equals fragility. The media loves showing seniors knitting quietly, not deadlifting at the gym. But the truth, many injuries happen because we stop challenging ourselves. A large Australian study in Age and Aging 2017 found seniors who practiced high-intensity balance and resistance training cut their fall risk by up to 40% compared to those in gentle programs. And I'm not saying go out and start parkour, but maybe you're stronger than the world gives you credit for. A 70-year-old I knew joined a Tai Chi class that incorporated light squats and lunges. Not only did his balance improve, he said he stopped feeling like he had to clutch the handrail on stairs. So when advice sounds like it's wrapping you in bubble wrap, question it. Here's a topic that gets swept under the rug: mental health. Most health advice for seniors hyper-focuses on physical stuff: heart health, joints, digestion. But what about what's going on upstairs? According to the National Institute on Aging, depression in older adults is often underdiagnosed, and untreated depression can worsen physical illnesses. Loneliness, as we've said, isn't just sad, it's deadly. A famous 2015 study in Perspectives on Psychological Science showed that loneliness can increase your risk of premature death as much as smoking 15 cigarettes a day. Yet, how often do you hear, join a club or volunteer as part of health advice? We need more of that. In Okinawa, Japan, where people often live past 100, they have something called moi, a small groups of lifelong friends who support each other. Social ties are literally part of their health plan. Here's something few talk about. The data behind advice isn't as universal as it claims. In that JAMA review I mentioned, not only were older adults underrepresented in clinical trials, women, Black seniors, Latino seniors, and low-income seniors were often left out too. That matters because, for example, Black seniors are at higher risk for high blood pressure. Yet advice is often based on studies of white participants. A 2022 article in The Gerontologist stressed the need for more culturally relevant, age-inclusive research. If the research doesn't include you, the advice might not work for you either. Let's talk food. You'll hear things like, seniors should eat smaller portions, go low-fat, cut salt. Sure, there's a time and place for moderation, but blindly cutting everything can backfire. A 2019 Journal of Nutrition. Health and Aging studies showed seniors who ate higher protein diets preserved muscle mass better and stayed more independent. Seniors often need healthy fats, think olive oil, nuts, to help with vitamin absorption and cognitive function. Yes, excessive salt can be harmful, but did you know low-sodium diets can cause hyponatremia to little salt in the blood, which is dangerous too? Instead of cutting everything, the smarter move is tailoring your diet to your medical needs, activity level, and preferences. Let's be real. Generic advice is easy to dish out. Exercise more, eat better. But what does that mean for you? Personalized medicine, or precision health, is changing the game. This can mean genetic screenings to spot unique risks, wearable tech, tracking sleep, heart rate, and activity functional tests like grip strength or gait speed. A 2021 Frontiers in Medicine paper highlighted how even simple functional assessments can predict health outcomes better than age alone. Imagine if your doctor said, "Let's see how you move. what your heart is doing, what your labs show, instead of "you're 75, so do this." Let's wrap with how you can spot advice worth following. It's practical. Saying "just be healthier" isn't advice. Saying "aim for 20 grams of protein at breakfast" is advice. It feels respectful. If it talks down to you or assumes you're fragile, be skeptical. It comes from reliable sources. Be wary of advice that promises miracle cures or uses fear to sell products. It invites partnership. The best advice encourages conversations with your doctor, your trainer, your dietitian, not a one-way lecture. If advice feels too one-size-fits-all, ask your provider. How does this apply to me specifically? The bottom line is this: your age is just one piece of the puzzle. Health advice should be as unique as your fingerprint, and you deserve guidance that reflects that. Tell me in the comments, what is one piece of health advice you've heard that made you roll your eyes? Or what's something that really worked for you? If you liked this video, hit that like button, subscribe for more honest aging talk, and share this with someone who's tired of cookie-cutter health tips.